Whatever you do physically, it actually feeds back into the brain. We actually have a fascinating case right now of a female patient. She decided to actually go back to law school in her 50s. And we started her on hormones in her, right at the beginning. And I just checked in with her. She finished her first year. And I asked her, how are you handling law school? And she said, it's really tough, but I'm handling it really well. And now she's on estrogen, she's on progesterone, she's on testosterone. And I asked her, are you still training? She's like, as best as I can, I am. And I'm like, how are you doing in school? And she said, I'm at the top of my class.
I'm Todd Vande, CEO of Stark, and I've gone from vegan to paleo to keto to carnivore, from cryosaunas to ice baths to training like an athlete to being injured like one, enhancing my mobility and enhancing my sex hormones with thousands of labs and various forms of scans. I'm surrounded by high-level medical doctors, naturopathic medical doctors, chiropractors, nutritionists, and strength coaches, all leading me in concert to a state of optimal health. And I'm here to share that journey with you, regardless of your age, your genes, or your medical conditions. Today's guest is Dr. Alice Nguyen, a naturopathic medical doctor, performance strategist, and living proof that in your 40s, you can be in your peak decade for men and women. I actually think her peak may be in her 50s. Her body composition, her skin quality, if you're watching this on YouTube, you'll see it, and muscle definition are all really and truly next level. And we're going to find out how exactly she did it. Dr. Alice Nguyen is known for helping men and women navigate the complex terrain of aging, hormones, and aesthetics with science-backed precision. As a practicing NMD with a specialty in performance optimization, she's equally obsessed with looking good and feeling strong well into her 40s and beyond. So you never stop doing things with your body, but the things that you used to do when you were younger changed a lot as compared to what you're doing today. Is that right?
Like younger when? In my 20s, 30s?
Yeah, like when you were just doing martial art.
When I was just doing martial arts, I was doing no strength training.
Okay.
So the first 8 years I was doing martial arts and competing in martial arts, I did no strength training, no power training. It was just martial arts.
Okay.
I started picking up weight training when I became a trainer when I was 28. And since then, never stopped. My intensity has been kind of up and down, depending on, obviously, med school work, but I never stopped moving.
So you never stopped strength training, but why did you start in the first place? You weren't thinking about longevity when you were in your 20s.
No. Well, I was thinking more about longevity and competing in martial arts.
Okay. So as an athlete. You wanted to extend your
competitive
athletic career.
Yeah. I wanted to compete for as long as I could.
And so because you were a martial artist, it was specifically to be more explosive, more powerful.
Yeah. Be able to hit harder. Be able to
hit the girls harder.
Guys too.
Yeah. Do you fight men too?
No. Well, in practicing, but not in competition.
Okay.
No, clearly I would totally lose every single time.
So you did it through competition. But what did you learn in that process?
I was able to bulletproof my body.
What do you mean by that?
I thought I was going to need knee surgery, hip surgery, back surgery, shoulder surgery, neck surgery because of all the imbalances that my martial art was actually creating.
You were actually experiencing pain in them?
Oh, yeah, a lot.
Okay.
Yeah. And I met an incredibly intelligent strength coach and a rehab specialist who identified my weaknesses and my imbalances, addressed it, and I have very little injuries since then.
What's his name?
Peter Rouse, Dr. Peter Rouse.
And he's the dude that moved to New Zealand?
Yeah, he's from New Zealand, but he relocated. He's retired in home. Queenstown.
Okay. And so we have some elements of Peter within Stark, right? There are bits and pieces of him, but in various practitioners more specialized. Is that right?
Yeah. So he was a functional medicine practitioner. He was also a soft tissue specialist.
Okay.
So he did a lot of what we called neuromuscular therapy at the time.
Okay.
So soft tissue works somewhat similar to ART, corrective exercises, and obviously strength training, program design.
Mm-hmm. They're all put together.
All put together in one
nutrition?
person. Nutrition as well. So he taught me about nutrition as well. And that's the other thing is that my nutrition changed ever since I met him in 2009. So
Is it similar to what you're doing today?
It's very similar.
Yeah.
So he introduced the concept of eating grass-fed organic, not eating.
That was really early in 2009?
Yeah, 2009. He did like a nutrition like a talk about the 10 nutrition myths that you should know about. And one of it was, you should be eating grass-fed beef. And the other is you should be eating organic. And the other thing, he was an early adopter of the paleo diet, so grain-free, dairy-free. So for a while, that was actually my diet as well. So my diet really hasn't changed much, honestly. So
were you eating vegetables back then?
Like kale.
Okay.
I was eating kale, yeah, a little bit. But for the most part, protein forward.
Was it as much protein as you eat today? Because today you're eating like 150 grams a day or something?
160, but 160? 20 of that is actually from collagen powder.
Okay, so 140 of actual, like, complete protein.
Yeah, whole
from
protein.
Food.
From animals.
From animals.
Yeah.
As compared to 2009, what do you think? You weren't measuring really back then, were you?
No, I was actually measuring back then, too.
Oh, you were? Okay.
Yeah. So he got me to eat my body weight in grams of protein. That was
130-ish?
120 to 130, yeah.
So not that far off at all.
No, not really.
So your diet hasn't really changed at all since then?
I eat rice on occasion. So
today, but you ate that back then.
I didn't really like rice, actually.
Well, that's bizarre.
Yeah, I'm a bad Asian. I don't like rice. So that's probably once or twice a week I'll eat rice. Okay. Or rice-based kind of stuff.
Okay. So much of this sprung out of your athletic endeavors, the things that you wanted to accomplish with your body to compete. You were a competitor. But you're not competing today.
No.
Maybe you'll compete again in the future. Who knows? Maybe. Right?
Unlikely. Maybe. Not in that sport.
You're too old.
So. It gets to a point where getting hit in the face is not fun. I'm 45, so, it's got to protect the brain a little better.
I haven't gotten hit in the face since I was like 12.
I can help with that.
I'm sure you can. Yeah. So things have changed. Your goals have changed. You're more focused on longevity and health optimization today as compared with athletic pursuits. But a lot of what you do, at least from a strength training and lifestyle and nutrition standpoint, they haven't really changed that much?
No, not really.
Right? Well, that's interesting.
These are requests I have with, our master programmer, Rolandis, is like, I still want the explosive movements. I still want the reactive training. I still want the plyometric training. Something that simulates what I was doing before, because I still enjoy doing those sorts of things. And when it comes to power, we women will lose our power first and foremost.
I mean, men can too, right?
Yes. But women in particular. So there's a whole concept called powerpenia when I was actually doing a presentation.
Powerpenia?
Yeah, so sarcopenia,
For our listeners, can you explain what that is?
So powerpenia is going to be the loss of power in our generation.
Okay. What's sarcopenia?
I'm sorry?
Sarcopenia.
Sarcopenia is the loss of muscle mass. So
those two factors are big concerns for women, of course.
For men and women, but women in particular.
Okay. And so the explosive training, the athletic type strength training programs that you do helps counteract the natural decline in those areas. That's what you're saying?
Yeah, that's the hope.
That's the hope. Okay. So for most people that listen to podcasts, by the way, watch them on YouTube today. So we got a lot of viewers that are seeing us and you, and they can tell that I'm like about your age, right? And I look fantastic and everything, but you actually, you look much younger, I think, than 45. Let's talk about how, and I have witnessed the complex nature of your skin protocols. It's astounding how much effort goes into like getting ready for bed. I mean, maybe I'm exaggerating. Let's call it like 8 minutes, but you've got all these things going on. You're scrubbing your face and all that stuff. Let's talk about those superficial things that you're doing. And then we're going to talk about the internal work that you're doing that really has a major impact on enabling you to look the way you do from a skin health or a vibrancy standpoint.
So the products that I use have been vetted by my sister, who's an esthetician. And in our family, we all have particular topics that we are zealots about. So for me, it's going to be health and fitness. My sister is going to be skin health. So, she utilizes a lot of the products that are very clean, paraben-free, no issues when it comes to being xenoestrogens, being as clean as possible. So that, again, is everything that I use.
Can you talk a little bit about what xenoestrogens are?
Fake estrogens. Phthalates, that's also another thing that you typically find in a lot of skincare products that can really kind of mess with the hormone system for both men and women.
What other kinds of products would you find those elements in?
That's going to be like body lotion, shampoos, perfumes, which I do not advise anyone wear, deodorants. So I don't use deodorant. I'm lucky. I don't really sweat.
It's kind of weird.
I'm a jungle Asian. So, it takes
you're just
extreme heat for me to actually start to sweat. I think you finally saw me sweat in Necker Island when we were riding the bicycle and for 10 miles and, paddleboarding for 3 hours.
Yeah.
So.
Yeah, it did take a lot. It's kind of startling.
It's extreme heat that will actually make you sweat. But, I'll also, a lot of the Eastern or the Southeastern Asians, they don't have this gene that would predispose them to actually having body odor. So I'm one of those lucky Asians not having those genetics.
So from a skincare product standpoint, you're trying to be really, really clean. That's a health pursuit through these skincare products, right?
Yeah.
Like the negative impact they can have on your hormones, as you described, if they're of poor quality or not of exceptional quality. They seem to kind of rotate. Like I never see the same brand. I don't see the same brand at home that I saw, 4 years ago.
I'm constantly seeing if there is a better product.
And
there are many products out there that will be third-party tested and vetted by other zealots in the industry.
Okay, so there's like enough zealots to police the skincare product industry.
Yeah, for sure. Yeah. They're way more, hardcore than I am, and I'll trust their vetting process.
How do you have access to the work that they've done?
They post it.
And where do they post it?
Usually there's one group called Mamavation. They do third-party testing on a lot of different products. That includes like coffee beans, coffee machines, body lotion, body wash. So they'll release all their third-party independent testing on some of these websites.
Okay. And then let's also touch on like cookware and other products that you use in the home that are common for everyone. Like what kind of pots and pans?
So it depends on the patient. Now, for both you and me, we tend to have higher levels of iron because we do actually eat a fair amount of red meat.
Okay.
And so if iron deficiency is not an issue, then I will tell patients to avoid cast iron because a lot of that iron can actually leach into the food, and then the patient will ingest it, and it'll actually elevate their iron levels.
Yeah, I remember cooking on a cast iron skillet most of the time and a cast iron grill. And way back then, my iron levels were quite high.
Yeah, your iron was super high, your ferritin was high. So we basically, pulled you off of the cast iron and all normalized.
And now it's what? Stainless steel.
Yeah, now it's stainless steel. Now, some people actually have a nickel allergy, so you have to be a little bit careful about that. So some stainless steel will contain high levels of nickel, which unfortunately will cause some issues for some people.
Okay.
So there are, two different classes of stainless steel, one with nickel, one without. And, really kind of depends on the patient.
But this is an actual thing to focus on. If you're thinking about your health, if you're just thinking about beauty, you should be thinking about the pots and pans that you're cooking with, right? They'll have an impact in some indirect way or sometimes direct way.
Yeah, too much iron is actually inflammatory.
Okay.
Yeah,
you can drop your systemic inflammation by minimizing your exposure to iron.
Yeah.
If you have an issue with not enough iron, you can cook with cast iron.
Yeah, for vegans, vegetarians, and patients who have, don't eat red meat, have low iron stores, it's very effective at
it seems to be common among women that are still of childbearing years to be low in iron. Is that right or not?
No, it depends.
Oh, okay. So it's
if they have extremely heavy periods for whatever reason, then they're going to have iron deficiency.
Okay, and how do you test iron level?
So blood test
what does it cost?
Like if you just paid cash, through, or at least here at Stark, the cost of iron labs is probably less than $20.
The actual lab itself.
The lab itself.
You can go to Quest. You can get one for $20.
You'd actually have to go through our company to actually get that type of pricing.
Or your medical doctor's office.
You're going to have to request. They might grant that. They might not. It really depends. Like ferritin, you can't believe how often ferritin is just left out in a panel. Okay. And that's a more accurate measure.
But for our listeners, if they're going to have a checkup with their doctor, their OBGYN or their
they have to
doctor,
they have to ask
hey,
for
test
it.
my iron.
They have to ask for it.
It's not a big expense. It's not a big deal.
It shouldn't. But, again, depends on whether the doctor wants to order that or not.
Okay. It seems like the medical community is getting a little bit more pliable today as compared to years past. Like they used to be so top down And now I think a lot of medical practitioners are questioning what they've learned. They're more open. Like my cardiologist told me to bust out my chat GPT to check what he was telling me or suggesting to me, which is really interesting. That's a giant departure from previous experiences that I've had. So I think that's changing a little bit. And I guess the reason I'm bringing that up is because we should encourage listeners to just ask for these things.
They need to advocate for themselves.
Learn, go into the doctor's office, get tested, ask to have that added.
Yeah.
It's certainly not going to be harmful.
No.
It's going to be harmful in terms of lightening your wallet by $20.
It's not $20. I would just say that if you're going through the insurance system, it's a little bit more complicated than that.
Okay.
So if the doctor doesn't know how to bill for it and code for it, then the patient actually might be paying more out of pocket.
Okay.
So we don't mess with the insurance system. Like everything that, at least if we go through Quest or our other lab company called Vibrant, we know the cash price. There's no surprises. But, again, when we go to the conventional system, you have to worry about, if it's being coded appropriately with the right diagnosis codes and if the insurance company is going to cover for it at all. And it depends on the actual plan of the insurance company. Mm-hmm. So, again, it's more complicated than that.
Okay. Let's switch gears a little bit and talk about, before we do this, let's touch on other household products and just to put on the radars of the listeners that this is an actual thing to be focused on. So now I'm talking about all the things that bug me, right? Like dishwasher detergent, dish soap.
I understand what bugs you. You're not the one buying it.
I am actually. Branch Basic.
Oh, that's
not a plug for that company, but it's a very, very clean.
Yes, it is very clean, very clean product line. So,
what's all that about?
It really depends on what forever chemicals you're actually exposed to.
What forever chemicals? What's a forever?
So again, microplastics. These are all is an example of that. It's very difficult. They don't break down in the environment as easily.
Okay.
This is a huge issue with plastics right now.
This stuff gets put on your skin and absorbs into your body. Is that what you're saying?
Yeah, on your skin, or you ingest it,
or you eat it,
or you smell it.
So you breathe it in.
Yeah, any of these things.
Okay.
So the body has difficulty detoxifying all of these novel substances that our species has not encountered.
Novel substances. So they're modern creations.
Absolutely.
Right? We didn't evolve with these.
No.
Over millions of years.
No, it just showed up in the past few decades, and evolution is slow.
Yeah, and so our bodies are like, "What the hell is this?" And reacts in an aggressive manner, trying to
potentially
fight it off, or
this is one of the theories as to why autoimmunity is on the rise, and cancer, and also cardiovascular disease as well.
Autism too, or not?
Potentially, yes.
Yeah. Okay, so squeaky clean products used to cook your food, used to clean your clothes, used to clean your dishes, in makeup, in skincare products, in hair care products, in shampoo and soap that you use in the shower. Right? All of those things.
Yeah.
Should be audited, sort of, and cleaned out. And is there, so the website to go to kind of cross-check the quality of products that you'd recommend?
There are some limitations with the Environmental Working Group, but that's a good place to start.
Okay.
So they have ratings.
EWG?
Yeah, EWG.org, I believe, is actually
so EWG.org.
Yeah.
Is a great place to start.
They can do a search on, Google or ChatGPT for Environmental Working Group.
Yeah. It doesn't need to be perfect, right? Because where people are starting is like shit.
It's really bad.
So you just start plucking one or two products out at a time over the course of years, and over a period of time, you're going to end up in a good place. Right?
Yeah. And
your body's
again,
going to start operating more like it was designed to operate, and not being exposed to as many environmental toxins. That's kind of the idea, right?
Right. Yeah.
Okay.
And it's one thing at a time. Like this is something that I have worked on since 2009.
Okay.
And it's, work in progress. This is not the lowest hanging fruit for our patients, though. Like, once they get to a particular point where they're like, okay, I can handle more, then we basically start talking about these sorts of things. But in the beginning, at least that's where patients at start. We start at the foundations. Like, hey, stop eating shit.
Right.
Like, eat proper food, whole foods, unprocessed foods. First and foremost, eat more protein, move more, get more hydration in. The basics first. So I think there's a famous saying that don't major in the minors.
It's a good one.
So at least
do the big things well, simple things well.
Exactly. Yeah.
and don't get so wrapped up in the tertiary things that are exciting or interesting that you see on Instagram.
Yeah,
Right.
just, wait till later. Yeah,
They're basic.
Get your foundations down first and foremost.
Let's go deeper in the topic of beauty. Because what we're seeing is essentially the exterior of your interior, right? Like your skin tone and quality, and your hair and nails, and what makes up the perception of youthfulness or beauty on the outside, in many cases, doesn't come from what you're doing to your skin directly. It comes from the interior, right?
Yep.
The inside of your body. So what are some of the most important things to focus on? Liver, gut health, hormones. Like, what would you recommend people start in terms of their internal health, and how would they assess how they're doing?
So this is kind of the interesting topic, and two of my associate doctors actually went to a dermatology conference, an integrative dermatology conference recently. And when I take an inventory of all the patients at Stark and think about their skin quality and their skin health and how they look, when they first come to us, obviously, they're kind of busted.
They're kind of busted.
And then as they go through the process and they eat better, they stop drinking, or they start taking certain supplements, then they actually start to look better, not from just a composition standpoint, but from like an aesthetic standpoint. Their face.
Yeah, it's really quite fascinating.
Like, you'd rarely see a patient at Stark where they have like acne all over the place. First of all, we NDs will address that if that's the case. One of the concerns of testosterone replacement therapy is, I'm going to get acne. And we have over 100 patients who are on TRT that we monitor incredibly carefully. And you guys don't have to.
Do people think that's the case because of what, like bodybuilders or something? Or young men that have really high testosterone? But that's a natural production in relation to underdeveloped liver function because they're so young. Is that what's going on there with young boys that get acne?
They get acne. First of all, there is a lot of testosterone that they're making, that their liver is actually sluggish and not processing appropriately. But also, what are these boys eating from a food standpoint? If they're eating ultra-processed foods and just crap in general, that's going to be reflected in their skin. So we don't see that in our men. Sometimes I'll get a response or a report that they have acne. And what we do is like, hey, increase your fiber intake. Bind up a lot of the metabolites of the testosterone you might be experiencing or like producing, and get it out of the body. And
because it's passing through their skin instead of...
It's whatever is in your gut is going to be reflected onto your skin.
Okay.
So if you have poor gut health, then you're going to have really poor skin health.
And that's such an interesting topic because we're talking about your fabulous beauty. Well, when you go to a dermatologist, it's all superficial. Like I go to a dermatologist every 1 or 2 years to get screened for skin cancer. And there's no discussion about my internal health. It's all superficial.
That's not how they're trained.
Yeah.
But
it's so interesting because the entirety of their effectiveness or a giant portion of their effectiveness is being skipped over.
So if you go into the conventional dermatology world, and I know this because I actually interned with a conventional dermatologist for over 2 years, the way that they basically address a lot of these skin ailments is going to be either steroids or antibiotics, which is actually pretty interesting. Accutane is the other one. But, if you think about why they're prescribing antibiotics, or actually another one is a testosterone blocker called spironolactone.
Testosterone blocker.
Yeah. So it's actually a diuretic, but it also suppresses or actually decreases the level of testosterone.
What's that prescribed for?
Acne.
Oh my gosh.
For women.
That's devastating.
Again, it's just, treating the symptoms and not really looking at what's at the root.
And
now,
can you rattle off just some problems that would spring out of that for women that are on that treatment for acne?
Low libido.
So low libido.
Can't, poor body fat composition. Like they can't build muscle.
They get fatter and lose muscle potentially.
Depression.
Anxiety. Okay.
Low drive.
Okay.
So
a shift in their mental well-being downward.
Potentially. Not as bad as birth control, but yes.
Oh, really? Birth
not
control
as bad.
Is worse.
Yeah. And also birth control is used for for controlling acne as well.
Okay.
But the reason why is because it's suppressing testosterone.
I see. Okay. And so it's dealing with a superficial issue.
Yeah. Instead of like, why is this person having high testosterone in the first place?
Yeah.
And, again, if it's high testosterone, why are they not clearing it?
That's the big issue, right? They're not clearing it
like
properly.
the metabolites. Yeah.
Uh-huh.
So
in most cases, I'm assuming people aren't overflowing with testosterone. It needs to be suppressed so they don't have problems naturally.
It really depends. So,
okay.
Yeah.
And so let's talk about estrogen and what people perceive to be beauty, like physical or like a visible beauty.
So estrogen is important for collagen production.
So we see all over the gram people posting things about taking collagen supplements and eating things like connective tissue, like tendons and ligaments and things.
Which is great. That is what we do.
Yeah.
We do about 20 grams of collagen protein every day.
What happens if you got low estrogen or suppressed estrogen or screwed up estrogen because you're on birth control and you're trying to eat more estrogen because you want
estrogen or collagen?
I'm sorry, collagen.
Yeah,
because you want better skin tone and more pliability.
It's only going to go so far,
right? Because you're missing the root cause.
You're missing a huge catalyst to actually develop collagen in the first place. So estrogen. What's interesting is that what we're seeing is that there is a kind of an explosion of a market where they're selling estriol cream. So that's one form of estrogen. There's 3 actual estrogens: estrone, estradiol, estriol, and they will have a little bit of estriol in it for the face cream, and it actually improves the quality of the skin. So we've actually prescribed that for some patients as well.
Okay, and is that like a long-term prescription, or is it a temporary solution?
It's long term because, when women go into menopause or perimenopause, they're not going to be making those hormones anymore.
Replacement. There.
This is a considered replacement. Yeah.
Okay.
So,
and what about in terms of beauty? What about the rest of the sex hormones for both men and women? What haven't we talked about? We talked about testosterone. So when women go through menopause, they stop producing the testosterone levels that they really need to flourish.
Not just in menopause. We see low T in women in their 20s.
Oh, why would that be?
Many reasons. Could be the xenoestrogens that are actually out there too.
Okay, so drinking plastic water bottles or cooking on Teflon or
and things that they put in their skin.
Crappy skin products.
Yeah.
Okay. So that's one.
So that's one theory. High stress is the other.
Okay, so their perception of danger, right? They feel like they may be going to lose their job, or they're having issues with their boyfriend or their significant other.
That's a really interesting chicken and the egg situation.
Okay.
So these sex hormones are actually incredibly important for brain function. So, if they don't have it on board, they're not going to be really operating as optimal humans with great mental health.
Now, that's a really interesting topic and one that makes me nervous at the same time, particularly for women, I think, because when women go through that cataclysmic change in their hormone profile, so things just start dropping off a cliff and they're bouncing up and down, and they're going through night sweats, and there's a sense of panic. It's not just physical; it's the emotional connection to recognizing that you're aging suddenly really quickly, and so there's this psychological, emotional component to this as well. What freaks me out is that it's so hard to communicate with them because sex hormones are so tightly clustered in our brains. The ability to reason is sort of disabled.
It absolutely is.
So that's scary, right?
Yeah, it's certainly scary for that population.
Some of our listeners are 55-year-old females, and they're in that state, or 45-year-old females in that state, or some are younger even, right?
Yeah,
they're moving into that stage of life.
Could be late 30s.
They're experiencing. I'm so sorry if you're experiencing this. You're feeling this sense of like panic. That's physiological and psychological, emotional at the same time.
Panic and anxiety, depression, all those things.
Yeah, and so it's hard to make good quality decisions. What do you recommend? They need like a mentor to hold their hand through this. That's not a practitioner. Someone that maybe has been down this road.
This is actually one of our most challenging populations. In addition to their ability to really kind of rationalize and understand and comprehend things, the other issue is that they get a ton of misinformation that started with the Women's Health Initiative in the early 2000s.
2002. Yeah.
So there is this huge fear that has been perpetuated for the past 25 years of, the supposed dangers of hormone replacement therapy, estrogen and progesterone. Right. So trying to combat that, as well as, their they're conventional doctors who are not up to date and not really reading the updated studies and the reanalyses of that study, of the WHI study. So it's a constant battle that we actually have with these female patients. And sometimes they're delaying treatment for years. And the best I can do is provide them with information, articles, podcasts, videos, like whatever they need to actually educate themselves and be their own advocates. And whenever they're ready, then we basically will guide them through the HRT process.
Gotcha. And that period of time where they go from exposure to being ready is sometimes many years.
I have had patients delay it for 5 years now.
Wow.
And it's really...
And they lose that 5-year chunk of time to rebuild themselves, which is kind of frightening, depending on what stage they're in.
Yeah.
Right?
It's 5 years of their body degenerating. And if it goes to 10 years, then a lot of the histological changes in their bodies without the estrogen being in place, it's irreversible.
Just to round out those few comments you made about the Women's Health Initiative. So 2002 is when it was launched. Headlines were grabbed and pushed out into the media. Doctors around the world stopped prescribing estrogen. There was a specific brand, I think.
It's at the time, and this is what's interesting, is that that form of estrogen is actually not commonly prescribed today.
Okay.
So that's not in common practice, right?
Back then it was taboo. Women stopped being managed in terms of hormones. Hormones plummeted for that entire generation, 15 years. So 2002 to 2017. And what filled the gap, pharmaceutically speaking, is that a term, pharmaceutically? Was SSRIs, right?
Yep.
So in place of hormone replacement therapy and women feeling optimally healthy, they became severely depressed and were treated for that. And then you have the metabolic issues associated with SSRIs that sprung up right behind SSRIs.
Not just metabolic, but there are studies coming out that it's really contributing to potentially cognitive decline.
Well, that makes total sense because we're talking about sex hormone receptors being clustered in the brain.
I'm not just talking about the sex hormones not being present. I'm talking about those pharmaceuticals actually causing the cognitive.
Of the pharmaceuticals, right?
Yeah.
Okay.
So
that means it's like a double whammy.
Potentially, yeah.
So devastating for that entire generation of women. And we still, am I right about this? Hopefully I'm wrong. We still hear women being concerned about hormone replacement therapy causing breast cancer from their practitioners.
Every single day.
Every day.
Yep.
So it hasn't gotten into the mainstream medical community yet, even though in 2017, another study came out that
there's many reanalyses ever since in the past 5 years, at least since I've been in practice, past 9 years, actually.
Okay.
So
it just takes a long time. I mean, doctors are busy, I guess.
Misinformation will stay in the population for a very long time.
Really quite fascinating. So I'm assuming that your position on this for you personally is when you hit this stage in life, when you start to recognize your hormones start bouncing around, perimenopausal situation hits you, that you're going to go to a practitioner and have them walk you through the HRT management process?
Yeah. I wouldn't be managing myself, obviously.
Of course not. Yeah.
So you always have, I'm not objective.
You're not going to delay.
No.
You're just going to jump into it with both feet, go through the process and remain at an optimal level all throughout menopause.
Yeah.
And what would you expect is if you had two alternate universes and one where you're not on hormone replacement therapy and the other one you are, what does that look like? What are let's say menopause starts at the same age in both universes. What does it feel like if you're not on HRT? What's that experience for you? What do you think it will be like for you versus in contrast with actually being on HRT?
I can describe what our patients have actually described about their perimenopause or menopausal experiences. Person not on hormones they're going to be very anxious. They're going to be depressed.
Okay.
They're going to have no libido. They are going to have painful intercourse. They're going to have vaginal dryness.
Dryness situation. Okay.
They're going to have joint pain.
That's a thinning of the skin in that area too, right, or something like that.
Yeah.
That happens.
So it's vaginal atrophy.
And that's because of the absence of estrogen.
Estrogen.
Okay. Well, it makes total sense because it also affects your cardiovascular or your vascular system in the same way, right?
Yeah.
Estrogen
enables
pliability, skin pliability,
Collagen production.
Oh, right. Okay. So it's all coming to me now. We're coming full circle. All the like things that are youthful and bouncy become like sort of frail, like
Yes.
in the absence of estrogen.
Yeah.
And in the presence of estrogen, can you get some of that back?
You can maintain it.
You can maintain it.
Yeah, you can certainly maintain certain things. Aging will happen, although, again, there are some discussions that perhaps aging is going to be an option.
Aging is an option.
Again, with
if you
all...
can maintain what you've got going right now, when you move into menopause, theoretically, you can look like all this business in 20 years, right?
That's a hope.
Yeah.
I mean, yeah, there's going to be people who say that, oh, it's because you're Asian. That's in your genes. And I was like, no. Like, I know plenty of people. Yeah, Asian don't raisin. I know plenty of Asians who did not take care of themselves and at my age and don't look like me. So, again, now the huge missing piece, truly, true of it, is that their nutrition is not optimal and they aren't moving enough.
Yeah.
Now, when it comes to movement and training for women, the studies are already all out there. This has been known for a very, very long time. But women, whenever they engage in strength training, they actually generate more growth hormone compared to our male counterparts.
Yeah.
And growth hormone helps with regeneration.
Makes total sense. Yeah.
So I really do think in my particular personal case is that because I never stopped moving, it's the reason why I look the way that I do.
Mm-hmm. And you do put a tremendous amount of work, not just in strength training itself, right? But you also put work into making sure that you're able to move well.
Yes.
I see you laying on a lacrosse ball for hours on end and looking at your Instagram account or something, or maybe Microsoft Teams while you're doing it.
Microsoft Teams.
Yeah, whatever. It looks like Instagram to me. You're constantly working on such things to make sure that you can actually move really well. And that's a problem that people face as they get older. Like, you can't just come in and lift weights like these guys are right now. There's a lot of other preparatory work you have to do on a fairly regular basis that will enable you to lift weights, enable you to do strength training, enable you to do some of the athletic things that you currently do in your strength training programs, right?
Yeah.
Because as soon as you stop being able to do those things, that's the beginning of the aging
process.
That
is the beginning of the end.
Yeah.
Now, I've been injured before, like through martial arts or through even training. And I know how debilitating that is. But during those times, I work around the injury. I work with our chiros to help correct for it. But I continue to move. So it's not like I stop moving completely. That's not the point. So.
Yeah. Well, this has been great. Thank you so much for hanging out with me. On behalf of me and all of your other fans and followers, I love you. We love you.
I don't think I have as many fans as you say. Yeah. It's just,
Yeah. Well, your fans are from a very small community of people that you've affected in such an incredible way in transforming them in their body composition, their skin tone, their ability to move. My favorite, their ability to think clearly, their ability to recognize their emotions and not being overtaken by them. I mean, a lot of that has to do with internal health, gut health, detoxification pathways, hormones, sleep quality. These are all elements of the things that you and your team work really hard to help course correct within the STAR community and others through social media. And it is you've had a very powerful impact on a lot of people, on a lot of families, and a lot of the people that work for those people as well. So thank you for the work that you do. Thank you for the work you've done for me. Look how young I am. Holy shit. I'm like the youngest I've ever been since like 12. You're
a work in progress.
Okay, whatever.
Now, there's one point that I do want to emphasize that a lot of people actually don't take into consideration. When it comes to training, and again, I'm biased. I come from a training background. Everyone thinks that it's just like a brain down to the rest of the body when it comes to communication. It's actually both direction. This is actually what my mentors taught me in med school, is that whatever you do physically, it actually feeds back into the brain. So when you are trying to study, we actually have a fascinating case right now of a female patient who decided to go back to law school postmenopausal. Now, she wasn't on hormones forever. She started hormones at the beginning of her law school. So she decided to actually go back to law school in her 50s. And we started her on hormones in her, right at the beginning. And I just checked in with her. She finished her first year. And I asked her, how are you handling law school? And she said, it's really tough, but I'm handling really well. And now she's on estrogen, she's on progesterone, she's on testosterone. And I asked her, are you still training? She's like, as best as I can, I am. And I'm like, how are you doing in school? And she said, I'm at the top of my class. So, it's, yes, the hormones are there. They're the icing on the cake. But the fact is she knows to take care of herself and continue to move while she's actually doing something stressful like school, it allows her to actually not just survive, but actually be at the top of her class. Yeah. So there is a lot of important things that are happening from a movement standpoint when it comes to brain health and mental health.
Yeah, and, I mean, we're beginning to understand more and more about that, like the category of cytokines, myokines, that reside in your muscle tissue. And every time you exercise, you release them, and they're anti-inflammatory in nature. And when you drop your inflammation systemically, right, you can think more clearly.
Yeah.
I mean, people experience this in little tiny doses. After a hard workout, they just feel so, like, part of it, there are other things happening too. They feel a sense of euphoria. But if you look in like when I look in the mirror, these bags I have under my eyes, which is a source of, or a sign of some inflammation, they're gone. And you can feel it cognitively if you're really, really paying attention. You become very sensitive to that. And I can see how that would have an impact on studies. You're exercising your brain, your cognitive abilities.
It's right? The chemical in particular is called BDNF.
Oh, brain-derived neurotropic factors.
Yep.
Right? Yep.
Yeah. And one of the only ways to actually stimulate that, the production of that, is training.
Oh, interesting. Okay.
So that's why through med school, I never compromised my training. And that's the huge, I mean, I didn't graduate at the top of my class, but I didn't burn out. We didn't have grades, but, I didn't burn out. I continued to do well. I continued to thrive. I went to practice. I really don't feel burnt out. And a huge reason is, I continue to eat well. I train well. And that other thing that we didn't really kind of touch upon is that I do my very best to prioritize sleep.
Yeah. So you're a great sleeper. You get a lot of sleep, but the sleep that you do get also is high quality sleep, right? I try
my best.
Yeah. With the exception of looking at Instagram.
Nope.
Although let's talk about that.
That helps.
One little thing. Yeah. So you guys can all research this yourselves and see that it's a bad idea to look at your phones at night. Like, it's part of a good sleeping protocol to not look at your phone and not look at it immediately when you get up in the morning. But Alice is a very unique thing. She looks at puppy videos and animal videos, and she'll literally be laying there giggling. And so if you can get yourself into a state with maybe without looking at something like Instagram, or even if it is with Instagram, and get yourself into an emotional state where when you're going to sleep, you are giggling and happy, just in general, lighthearted, and it's a break from maybe your professional life or kids or whatever you have going on. That's helpful, right? And then when you wake up with that, in that state as well, I'm sure over many, many years, like a decade's period of time, that has a profound impact on your health.
It does.
Yeah.
Now I do have, my glasses are blue blockers. They're prescription blue blockers. Okay. And I'm very careful about what I have on my Instagram feed. So I make sure there's nothing, I'm not doom scrolling or anything like that. I if any particular account is excessively negative, I start blocking them.
Okay.
But if you take a look at what I follow, it's mostly really kind of ND, like educator accounts. And the other one, a gross majority, is going to be puppies and recently baby elephants, actually.
Baby elephants, yeah.
So it's either information about, training, medicine,
whatever, okay,
or puppy videos.
All right. Well, thank you so much.
My love language is sharing it with my family and you.
Thank you so much. You're an inspiration in our community. I'm sure our listeners are going to love this. Whatever you do, just do what she says, all of you guys. And if you'd like to learn more about Stark, you can find us at stark.health. That's stark.health.